Hi, this is David from OT Focus, and today I'm going to talk to you about why most people don't know about OT or occupational therapy. And the number one reason is the name, right? So occupational therapy is a terrible name. It's hard to kind of explain to people because most people think of occupation as like a job. And a lot of times when I'm working, people will actually say, I don't need a new job. And this is kind of something that I think as practitioners, we hear all the time. We hear it over and over. The name occupational therapy is just not a good name. It's not specific. And what is occupational therapy? Occupation just refers to our daily occupations, the tasks that we do on a daily basis. It could be our job, but it could also be getting dressed or using the toilet or showering or shopping or doing meal planning or meal preparation. Our normal daily routines, what we do in our day, which could also be working. So when people ask me like, oh, I don't need a job, well, I usually will joke around with them because occupational therapy could be about helping them find a job. It could be about improving their skills where they work or helping them to be able to go through the rehab process to be able to work again. But for the most part, occupational therapy is composed of a number of things, so many different things. So it isn't really one thing, and it's hard to explain that. A lot of times I will kind of explain it in terms of like rehab. It's kind of like physical therapy, but it's a more holistic approach because we're looking at cognition, we're looking at physical function like physical therapy, we're looking at social skills, we're looking at every aspect of a person's life and trying to find a way to make people more independent throughout their life. And another reason why most people don't know about OT is because it's just very similar to physical therapy. And a lot of people just assume that we're physical therapists because they see us with physical therapy, or what we're doing is getting people out of bed, and they just automatically assume like, okay, it's time for physical therapy because I'm doing physical mobility, I'm getting out of bed, I'm going to be walking. And a lot of times as therapists, like an easy way to kind of get somebody up is to say, I was going to see you for occupational therapy. Do you want to use the bathroom right now? A lot of times I just kind of incorporate that into my daily therapy session just because it's easier and it's sometimes difficult to explain to people over and over. But it is important for us as practitioners to always explain what occupational therapy is. And if they don't have a full grasp on it, you can ask them questions to help them to better understand our field and to kind of help them get a better insight into what we do as practitioners. Because it is very similar to physical therapy because occupational therapists do pretty much everything that a physical therapist does, but we do a whole lot more because we are focusing on people's daily occupations, their daily activities. And how do you do that? Well, you have to walk them because most people are walking to do and perform most of these activities. And then another issue is that a lot of people just think that occupational therapists might have the same role as like a nurse because we are helping people with their daily activities, with toileting or grooming or hygiene, helping them get into the shower, helping them bathe themselves. And then a lot of people question us, well, why am I doing this on my own? My other nurse does this all for me. And then we have to explain, well, I'm an occupational therapist. My job is to help you become as independent as possible with these daily routines so you can be independent when you go home. So that's another thing we're constantly doing is just explaining how we're different from physical therapy and nursing. And another reason that OT is unclear to people is because it's what we're doing isn't really that clear unless we explain it to the patient step by step. And that's why I really think that we need to start doing this more in our treatment approach to help people just better understand what OT is. For example, say you have a patient, they're brushing their teeth at the edge of the sink. What we're doing is we're making sure they're safe. We're making sure that they have good balance. We're checking their cognition to make sure they're sequencing while they brush their teeth. And we're also checking to see if they have the coordination to be able to brush their teeth in the first place. So while we might be checking all of these things, the patient just thinks that we're standing there, not really doing anything to help them. They may be wondering like what the purpose of our job is when we're just not really paying attention to them, or we're not helping them to be able to complete a task, when in reality, we're doing a whole lot of things. We're analyzing to make sure that they're safe, that they can be completely independent when they return home, and that they have the cognitive process, they have the coordination, they have the strength, the balance to be able to do this activity. So that's something that you can just incorporate in your practice, is just start explaining more what you do as you do it. So while a person is standing at the edge of the sink, brushing their teeth, it's not very easy for them to talk. So that's a good opportunity for you to just explain what you're doing while they're standing there. I'm making sure that your gait is okay. I'm making sure your balance is okay. I'm checking your cognition to make sure that you are able to take off that toothpaste cap and you can go to the next step, which is to apply it to the toothbrush, and the next step, which is to bring it to your teeth. I'm making sure you can do all those activities so they have a better concept and understanding of what OT is. And I think a lot of reason why people don't know what OT is because it's just difficult to explain. And the more we start explaining it to our patients, they're going to understand it. The more they can start sharing that information with other people, and the more people are just going to understand what OT is in general. And a simple explanation that I tell most people on just how to help people understand what OT is that physical therapy helps people how to walk, occupational therapy helps people how to dance. And, I'm just metaphorically speaking here. We help people with their daily activities and what's meaningful to them. Walking can also be meaningful. We can be a part of that process as well, but we take things more holistically and we look at people's, their whole life, everything that's a part of their life and their daily function and what's meaningful to them. So I hope that kind of cleared things up and kind of helped you as you understand occupational therapy so you can explain it to others. And I hope you like this video. Please like, subscribe, and I'll see you in the next one. And I hope you have a great day. Thanks.